Hi everyone. Today I will be talking about neonatal abstinence syndrome and babies born to addicted mothers. The reason I chose this subject is that after I wrote my first paper for this master's program about children sex trafficking, I became very interested in social issues involving children. So when I found an article about neonatal abstinence syndrome, I chose it, despite the lack of actual research. Neonatal abstinence syndrome, or NAS, may occur when a pregnant woman takes drugs such as heroin, codeine, oxycodone, methadone, just to name a few. These and other substances pass through the placenta that connects the baby to its mother in the womb. The baby becomes dependent on the drug along with the mother. Today, NAS is defined broadly as the presence of withdrawal behaviors in infants exposed to dependency-producing drugs in utero. There was a five-fold increase in the proportion of babies born with NAS from 2000 to 2012, when an estimated 21,732 infants were born with NAS, the equivalent of one baby suffering from opiate withdrawal born every 25 minutes. The cost to care for each child has also increased to an average of $53,000 in 2009. In 2012, newborns with NAS stayed in the hospital an average of 16.9 days, compared to 2.1 days for other healthy newborns, thus costing hospitals an estimated $1.5 billion. The majority of these charges were paid by state Medicaid programs, reflecting the greater tendencies of opiate-abusing mothers to be from lower-income communities. And this is a diversity issue as it focuses on a specific low economical part of society. Rates are highest in the region of Tennessee, Mississippi, Alabama, and Kentucky. With a bag of heroin now cheaper than a pack of cigarettes, people once addicted to costly prescription drugs are turning to the cheaper street drug, according to the Centers for Disease and Control Prevention. As a result, heroin has invaded suburban and rural America. Immediately after birth, some cocaine-exposed infants are often in great distress. Jittery and suffering tremors, the infants are sensitive to any kind of stimulation. Their muscles are stiff and they often cry a lot. The distress of these newborns is obvious, but they are unable to calm themselves. Sometimes, cocaine-exposed infants display the opposite characteristics. They sleep much of the time and appear to shut down as if to avoid outside stimulation. The development of children exposed to opiates in utero has been well characterized, but there is a lack of information about what happens after these years. Prenatal exposure to heroin has been associated with behavioral disorders, attention problems, hyperactivity, and an increased risk of ADHD. The risk for developing these is strongly influenced by the child's caregiving environment. This is a chart I found on the National Institute on Drug Abuse site, and it shows some of the same numbers I just talked about, as well as the rise in maternal use in the last years that you can see is quite significant. Opium capsules have been found in Neolithic burial sites in southern Spain and have been dated back to 4,200 BC. Around the world, opiates have been used at one time or another to treat almost every disease and condition known. Until the late 1800s, any person in Western society, whether qualified or not as a doctor or pharmacist, could buy and sell opium. This pattern eventually changed with the passage of drug laws, with men then being more likely than women to use illegal narcotics such as morphine and heroin. These changing responses to opiate use arose from the 19th century influences such as class tensions, the process of medical professionalism, morality, and racial hostility. In both the US and Canada, early drug legislation was influenced by moralism, racism, and economic concerns. Early drug laws, as the 1914 Harrison Act in the United States, were direct responses to political pressures. The current drug act in the United States is the Controlled Substance Act of 1970, which is continually amended to deal with the changing availability of new synthetic drugs. A 1975 article in the journal Addictive Disease is considered to be the first and a very decisive and often quoted clinical publication on NAS. The article defined a treatment protocol and described the neonatal abstinence syndrome. Historically, infants have been exposed to opiate both prenatally and after birth. In the late 1800s, the medical literature contained description of symptoms displayed by infants born to women who used drugs, primarily opium in those times, that are remarkably similar to current descriptions of neonatal withdrawal. Nowadays, when an infant is diagnosed with NAS, the images, beliefs, and perceptions associated with illegal drug use define this illness. As there is not enough literature out there yet on the subject, from the few sources that I could find, these are some of the opposing views on NAS. First, blaming the socioeconomic status of the users and mapping it to the specific problematic locations, and making drug use a modern issue versus the drug problem being seen as a popular media creation because it has always existed and is not just a modern problem. Early reports in the media based on anecdotal evidence resulted in a rush to judgment about the impact of illegal drugs on the growth and development of children. Second of all, the only research available is of biomedical nature, and there is no consideration to the outside social, historical, or political influences. Third, it is often compared and put in the same category as alcohol-fetal syndrome, as this illness has been researched and categorized, whereas NAS needs more research and needs its own category. I broke the slide into two groups, the power brokers being the government and the current legislation, and the subordinate group being the infants and the addicted mothers from a lower socioeconomic class. The dominant group has conservative views over some permanent solution offered by some organizations, as project prevention that I will talk about shortly, and there's always lack of money for more studies that could help better understand the consequences and the long-term issues NAS might cause. The subordinate group, the victims, are usually from a lower socioeconomic class and environment with very little access to proper care and education. A child diagnosed with NAS is automatically put into a category and called names, so the illness defines the image and belief society has of this category, thus creating a deeper diversity issue than just tackling a drug problem. These are three of some champion organizations that I found, and unfortunately, most of them are local entities and do not have national ramifications. Project Prevention offers cash incentives to women and men addicted to drugs and/or alcohol to use long-term or even permanent birth control. The organizations offer $300 and £200 in the UK to each participant. The organization initially offered more money to women who chose tubal ligations and men who chose vasectomies than to those who chose long-term birth control, but criticism forced them to adopt a flat rate. As of May 2014, based on survey form from 4,913 clients, it has paid 2,876 or 58.5% Caucasians, 1,020 or 20.8% African American, and 569 or 11.6% Hispanic. This organization serves multiple states and hopes to soon reach more of a national coverage. The Miami Valley Hospital Foundation is the principal funding arm of Promise to Hope Mother to Baby, a pilot project based at the hospital that was created to coordinate the care and case management of mothers and infants with their doctors and their social service providers. Bridges Path provides inpatient medical care for drug-exposed newborns, non-judgmental support for mothers, and education services to improve family outcomes. Two local women are collaborating to open Bridges Path in Ohio and will be the first facility in Ohio to allow infants to go through withdrawal in home-like nurseries outside of a hospital. Most of the research reviewed considers children's development through age 4, with a few studies looking at children through age 7, so there are no long-term longitudinal studies that look into the long-term effect. This is partly from lack of interest that is usually regarded as a less important issue, as well as lack of financial resources. Research should also focus on the environment of the families in which infants are born, as this can also explain the nature of drug use, and useful help techniques can be based on that rather than just the after problems. The rising frequency and cost of drug withdrawal in newborns points to the need for measures to reduce antenatal exposure to opiates, but also reduces the social misconception of the users. Some organizations, such as Project Profession, has had to change their policy as they were judged because they paid more for permanent birth control than more temporary ones. Their explanation is that their limited budget only allows them to fight certain aspects, and they prefer to spend what they have on preventing later than curing later on. Since we know there is a lack of drug treatment available to addicts, I think we can all agree that being on birth control unless or until they have the opportunity to get clean is a first positive step for all addicts or alcoholics. Limited resources and stigma discourage women from seeking treatment for fear of having the baby removed from their care. Renewed efforts must be made to reach drug-troubled women before they get pregnant, and in the event they're expecting a child, community clinics and hospitals need to be educated about addiction treatment and where to refer both mother and baby for long-term care. Nurses also required advanced communication and relational skills to work with and effectively support birth families that are coping with multiple life stressors and also often dealing with interventions from child protection services. Nursing care greatly influences how infants progress through withdrawal and how parents are taught to support their infants. The rising frequency and cost of drug withdrawal in newborns points to the need for measures to reduce antenatal exposure to opiates. There is an urgent need for long-term studies. In longitudinal studies, researchers also need to incorporate additional environment and contextual factors significant in the lives of children and families. Currently, Tennessee is the only state in which a woman can be prosecuted for using illegal drugs while pregnant. Women are offered a choice between serving time in jail and joining a rehab program. Many states have expanded their civil child welfare requirements to include substance abuse during pregnancy as grounds for terminating parental rights in relation to child abuse and neglect. Lately, many local awareness campaigns have surfaced, and I found two different ones. The first one gives a toll-free number in Florida where anyone can call for support, whereas the second one with the baby bottle full of prescription medication is more visual and plays onto the idea that everything the mother takes, the infant also takes. I truly believe that media exaggerates the facts and they are wrong in presenting the drug problem NAS as a new modern society issue because drugs have been recreationally used much more before the passing of drug laws than even now. And instead they should focus more on how to protect the lives of innocent infants born in this category. I think it is extremely important to have longitudinal and current studies so that we can have a clear picture of the long-term effects and consequences of NAS. To date, accepted clinical practice guidelines remain grounding in research that was conducted over 30 years ago. Financially, we need to allocate money to a better prenatal program, which is largely part of also a better health system in general. I've also added my references. Thank you for listening to me.